To diagnose prostate cancer, we usually have to do a biopsy of the prostate. Traditionally, we've done a transrectal biopsy, which has been through the back passage. The problem with that is it's associated with an increased chance of infection because you're clearly going through the bowel. So we developed over the last 10 or 12 years a different technique called a transperineal biopsy, which I've been doing. And what we do with that is under a light anaesthetic, we put a probe in the back passage, we have a little template between the scrotum and the back passage, and we put fine needles in that skin between the scrotum and the back passage and get very fine samples of the prostate. And with that, infections are virtually unheard of. And it allows a very accurate pattern as well of the cancer in the prostate. And these days with new treatments such as focal therapy, where we may look at treating part of the prostate, that very accurate mapping allows us to tell exactly where the cancer is, and we can treat that appropriately. Also, I use a more sophisticated technique called MRI fusion biopsy, where we get the disc that's got the MRI in the operating theatre, we scan it in on the MRI, we look at the abnormality. The biopsy is done under ultrasound control. We get the ultrasound pictures and the MRI pictures, overlap them together, then into real life. We have a mark on the ultrasound, and in real life we put these fine needles in and get samples exactly in the spot that's abnormal, and that's called an MRI fusion biopsy, again done by a transperineal method. These are day cases, patients tolerate them very well. The risk of infection is, as I said, minimum. You may have a little bit of blood in the urine, a little bit of blood in the semen, but that's all self-limiting. Perhaps a slight bit of bruising in the perineum, and that's self-limiting as well. So it's very well tolerated, done under a light anaesthetic, and I think this is a big advance in prostate biopsies.